Imagine your own body turning against you, attacking your lungs and kidneys. That's the chilling reality for those with Goodpasture's syndrome. It's a rare autoimmune disease, a dark horse in the medical world, where the immune system, designed to protect you, mistakenly wreaks havoc on healthy tissues. The lungs and kidneys become the battleground as they bear the brunt of this internal onslaught. And if that wasn't striking enough, the symptoms this syndrome brings with it can be even more alarming. So how do you know if you have Goodpasture's syndrome? The symptoms can be quite deceptive. The first signs of Goodpasture's syndrome can masquerade as more common ailments, making it a bit of a chameleon in the medical world. One might experience fatigue, nausea, or a loss of appetite, symptoms that could be mistaken for a common flu. However, the telltale signs of Goodpasture's syndrome are more specific. They include lung bleeding, which may cause difficulty breathing, and kidney inflammation that could lead to decreased kidney function. Now, how do medical professionals diagnose this rare autoimmune disorder? The process begins with a physical examination, where doctors look for signs of lung or kidney distress. This could be followed by a series of tests like blood tests, urine tests, or even a kidney biopsy to confirm the presence of the disease. The diagnosis is not a one-size-fits-all process. Instead, it's tailored to each individual's unique symptoms and medical history. It's a meticulous process, but an essential one, as early detection can significantly improve the prognosis for those with Goodpasture's syndrome. But who is most likely to get this disease? Let's delve into the demographics. The numbers tell a story, and in the case of Goodpasture's syndrome, it's a narrative of rarity and risk. Goodpasture's syndrome is indeed a rare condition. It's estimated to affect approximately 1 in a million people worldwide, painting a picture of just how uncommon this autoimmune disorder is. But let's delve a little deeper into the demographics. Although Goodpasture's syndrome can strike anyone at any age, certain trends have been observed. For instance, it tends to be more common in men than in women. The male to female ratio is roughly 2 to 1, suggesting a higher incidence among the male population. Furthermore, the disease seems to have 2 peak periods of onset, in the late teens to early 20s, and then again in the late 50s to early 60s. Despite this, it's crucial to remember that these are general trends, and Goodpasture's syndrome can still affect people outside these age groups. The question remains, what are the survival chances once diagnosed with this condition? Diagnosis of Goodpasture's syndrome is undoubtedly daunting, but what does it mean for a patient's longevity? That's a question that weighs heavily on the minds of those affected. Survival rates for this condition have improved dramatically over the years, thanks to advances in medical science. Treatment options are tailored to each individual and often involve a combination of medications to suppress the immune system's attack on the lungs and kidneys. For some, dialysis becomes a necessary part of life, supporting the kidneys in their vital function of filtering waste from the blood. However, complications can arise. In severe cases, the syndrome can lead to kidney failure, making dialysis or even a kidney transplant necessary. It's a sobering reality, but one that underscores the importance of early detection and treatment. Despite the challenges, the human spirit is resilient. People living with Goodpasture's syndrome continue to lead fulfilling lives, bolstered by the support of their loved ones and healthcare teams. Each day is a testament to their courage and strength. While Goodpasture syndrome is a serious condition, understanding it is the first step towards fighting it. Goodpasture syndrome is a complex disease, but let's distill it down to the key points. It's a rare autoimmune disorder where your own immune system targets the lungs and kidneys. Diagnosis involves a physical examination and specific tests. Symptoms can include lung bleeding and kidney inflammation. While the cause remains uncertain, it's believed that genetics, chemical exposure, infections, smoking, and certain medications may play a part. The disease affects both men and women, with survival rates significantly improved when treatment is quickly implemented. Remember, knowledge is power. And in the case of Goodpasture syndrome, it could be a lifesaver. Like, share, comment, and subscribe